A patient receives Metoprolol 25 milligrams PO. 30 minutes later, their heart rate drops to 42 beats per minute. They are dizzy, weak, and complain of shortness of breath. Do you give the next dose or do you hold it? And here is the scary part. NCLEX loves beta blocker questions because many students are not sure about when to give them, when to hold them, and the serious side effects that can hurt the patients very quickly. So let's talk about beta blockers and make this medication class very easy. What are beta blockers? Beta blockers are medications that slow the heart rate down. Think about the fight or flight response for a second. That's caused by the release of adrenaline. When your body is stressed, your heart beats faster, your blood pressure increases, and your heart works harder. Beta blockers block that response. That's why these medications are used for hypertension, angina, heart failure, cardiac arrhythmias, and after myocardial infarction. Here is the memory trick every nursing student should know. Beta blockers end in LOL, Metoprolol, Atenolol, Propranolol. Here is a quick lesson check number 1. What do beta blockers mainly do? A. Increase heart rate, or B. Decrease heart rate. What do you think? Place your answer choice in the comment section. Now, let's break down the way beta blockers work. To understand how they work, we'll need to look at what beta receptors are. There are 2 main types of beta receptors. Beta 1 receptors are found mostly in the heart. Think about one heart in the human body. Beta 2 receptors are found in the lungs and vascular smooth muscle. Think about 2 lungs. Some beta blockers are cardioselective, some are non-selective. Cardioselective beta blockers block beta 1 receptors. Examples are Metoprolol and Atenolol. Non-selective beta blockers block both beta 1 receptors and beta 2 receptors. Propranolol is an example. Beta blockers block the effect of epinephrine on beta receptors in the heart and blood vessels. The result is slower heart rate, reduced force of contraction, and lower blood pressure. This is why beta blockers are very helpful for patients with chest pain. Their heart will not have to work as hard anymore. Now, let's talk about the side effects you definitely need to know for the NCLEX. Number 1 is bradycardia. Remember, beta blockers work to slow down the heart, but sometimes they slow it down too much. Take a look at this. Your patient heart rate is 52 beats per minute. Do you automatically give Metoprolol because it is ordered? No. This is where you have to really pay attention. Always check the parameters. Many providers will say hold the medication if heart rate is below 60 beats per minute. Another major side effect is hypotension. If blood pressure drops too low, the patient may become dizzy, weak, lightheaded, or even faint, especially when standing up quickly. So, teach patients on beta blockers to change positions slowly. Check this out. This is lesson check number 2. Your patient on Propranolol suddenly becomes dizzy when standing. What is your priority action? Answer choice A, encourage the patient to ambulate quickly to improve circulation. B, help the patient to sit or lie down safely. C, administer the next dose of Propranolol early. D, restrict the patient's fluid intake. Place your answer choice in the comment section. Here is something to take note of. There is one beta blocker side effect that many students forget. Beta blockers can be very dangerous in asthma and COPD patients, especially the non-selective beta blockers, because beta 2 receptors help to open the airways. You don't want to block their beta 2 receptors. These receptors are needed for smooth muscles in the airways to relax so they can breathe easily. If you block them, that will lead to wheezing, bronchospasm, and difficulty breathing. This is why Propranolol is an important NCLEX medication to remember. This is lesson check number 3. The nurse will question an order for Propranolol in which of these patients? Answer choice A, a patient with asthma. B, a patient with hypertension. C, a patient with angina. D, a patient with hyperthyroidism. Place your answer choice in the comment section. And here is another side effect of beta blockers. Beta blockers can mask hypoglycemia symptoms. Normally, when blood sugar drops, patients may feel shaky and anxious with fast heartbeats. Beta blockers can hide the fast heartbeats. So, diabetic patient may not be able to recognize hypoglycemia very quickly. This means nurses must monitor blood glucose levels very carefully. Always assess your patient before giving beta blockers. Check their heart rate and blood pressure. Watch for falls and dizziness. As for patient education, teach your patient not to stop beta blockers suddenly. That can cause rebound hypertension or angina. They should change position slowly. Teach them how to monitor their blood pressure, and they'll need to report wheezing immediately. Let's do a quick recap. Beta blockers work to slow the heart rate, lower blood pressure, and decrease cardiac workload. They can cause bradycardia and hypotension. Beta blockers may mask hypoglycemia and cause bronchoconstriction in patients with asthma. This is lesson check number 4. A patient has an order for Metoprolol 50 milligrams PO daily. The patient complains of dizziness. Heart rate is 48 beats per minute and blood pressure is 88/50. What should the nurse do first? Answer choice A, give the dose as ordered. B, hold the medication and notify the provider. C, ask patient to chew instead of swallow. D, give with 2 tablets of Atenolol. Place your answer choice in the comment section. Thanks for watching and learning from this video. Subscribe, save this video, and don't forget to place your lesson check answers in the comment section. See you next time.